So Angie, thanks for talking with us this morning.
Absolutely.
I wanted to talk a little bit about getting clinicians engaged in helping design an EHR product, because we're hearing a lot from clinicians that, boy, it doesn't work the way we wanted it to, it doesn't work the way I work as a doctor. So tell me what you've done at Healthland and why that's important.
Sure. At Healthland, one of the things that we have found to be critically important in designing and building software that meets the needs of the market is really to engage end users. So rather than going off and writing a market requirements document, your product manager's doing that on paper and then sending it off to development where they code and we ultimately release a product that then we learn wasn't designed to support the workflow needs of the hospital. We instead take, for example, we're redesigning our CPOE product, and we took 23 physicians out of 23 different hospitals, and they worked with our product managers and our business analysts and our development teams on an iterative process from the point that we defined the market requirements on paper to storyboarding the way the product would look, all the way through the development and ultimately the release of that product. And that process of engaging end users means you're able to capture in the design and the underlying architecture of the product really a solution that meets the workflow and the business needs of the end user versus something that later on you have to try to fix. If you get it wrong from the start, you reach a point where you just can't fix it anymore. You have to re-architect it and redesign it. So this is a much better way, in our opinion, and in our philosophy and approach at Healthland, of designing and building products that meet the market's needs.
And how engaged were those doctors at the beginning? Were they setting the parameters for what the product would look like?
Yeah, they started off by giving us input into the market requirements document, all the capabilities and the feature functionality that would need to be present in the application. And then as we took from the Word document and translated that into a story and screens and wireframes of how the product would actually flow and the capabilities of the application and the usability of that product, that's where the physicians got very involved. And they would meet with our teams of developers and product managers and business analysts, and they would give feedback on that design. And when our end development organization and our product managers and the BAs could hear that feedback directly from physicians, they could then capture that into the design and the development of the product.
And how did you manage the fact that, Dr. Jones does it differently than Dr. Smith?
Definitely. Great question. So we would have the docs work that out. So when we're on a call and one physician wants to do it one way and somebody else wants to do it another way, they will work that out on the call. They'll debate and discuss between themselves, and we'll facilitate that dialogue. And in some cases, that means you build parameters or different configurations into the product so you can do it different ways. And in other cases, they resolve those issues and come to an agreed upon best practice and approach moving forward. And that's the path that we would take.
Great. Well, thanks for your time.
Yeah, thank you.